The Health and Human Services Agency of San Diego County is using taxpayer funds on a new ad campaign. You see it here. Critics say that this is doing more harm than good, and it is not based upon the data. The billboards you're looking at focus on what black women, they say, face racism and discrimination during pregnancy, and that black babies are dying due to racism by healthcare providers. Critics want the billboards removed due to the, quote, alarming and unsubstantiated claims that black babies are being harmed because of racism and discrimination. Joining us now to talk more about why he is calling for those billboards to be taken down is the chairman of Reform California, Carl DeMaio. Hi, Carl. How are you?
Doing well, Logan. Thanks for having me on.
It's our pleasure. Why do you think these billboards should be taken down?
Because they are advancing a false and dangerous narrative that racism is causing hurt and harm and even death to black babies. There's absolutely no data to support this outrageous claim. And this is being done with our tax dollars. If this was some private group out there wanting to divide us by playing the race card, it's a First Amendment issue. They're wrong, but it's their right to speak and share their view, as repugnant as it might seem. But this is not a private group. These billboards are funded directly and managed directly by tax dollars at the County of San Diego's Public Health Department. This same Public Health Department tells us we need to trust them, that they are going to be truthful, that they won't be political on COVID-19. But they're lying to our community. And there's no way to sugarcoat it, Logan. These are lies. When you don't have data to back up something as explosive as saying racism is killing black babies, that healthcare providers, doctors, nurses, hospitals are racist, you're lying and you're hurting people in the community, and it needs to stop. These billboards need to come down.
I know you've looked at the data, you've researched it to try to come up with an answer. What does the science say about the disparities in healthcare for black and whites?
Glad you asked that, because when these billboards first were brought to my attention late last week, I looked at the website that the county put up and found no justification for racism or discrimination. We then looked at all of the science-based, peer-reviewed research, all the professional associations and the American Medical Association, all the way down the line. And what we found were disparities do exist between black babies and white babies. However, the science and all the peer-reviewed research shows that it is income levels that drive the disparities, not race, not racism. Nobody cited racism in any of these journals, any of the data that's out there. The American Academy of Family Physicians on their website addresses this issue directly. And we've put out the quote. It says that poverty and low income status are the drivers of the disparities. And so that is an issue that we do need to deal with. But to say that skin color and racism is it's killing black babies is provably false. And what it does is not only divide us in a very toxic way amongst racial lines, pitting communities against each other, but it also undermines public trust and confidence in our healthcare system. We should want to make it easier for African American moms to get into the healthcare system and to trust their doctors and their nurses. These billboards actually make it toxic, and it will hurt the healthcare outcomes of these African American moms and their babies.
Is the county responding at all to you, Carl, in your effort to try to get these billboards taken down?
No, because they know that there is no response. They know the data is not on their side. They know the reason why they're doing this is that the county board of supervisors got taken over by 3 Democrats, and they are forcing critical race theory training for all employees on a mandatory basis. They declared that racism is a public health emergency, and they want to basically scare our community. They want to divide our community. It's not about medicine. It's not about healthcare. This is about, Logan, it's about politics, and it needs to stop. And might I also add that the only documented disparities in healthcare provision that I've been able to come up with since we got these billboards and started reviewing them is the disproportionate number of abortions in this country targeting African-American babies funded by the left. So if they want to have a conversation about who's killing black babies, bring it on. I think the data is very inconvenient for folks on the left.
Carl DeMaio, chairman of Reform California. Thanks, Carl. Good to see you.
Thanks so much.